Community-wide screening for tuberculosis in a high-prevalence setting. Tuberculosis is caused by a bacteria that most often affects the lungs. Tuberculosis is curable and preventable.
What is TB? TB is a curable disease but is still a problem in Singapore. Tuberculosis. TB is a dangerous and infectious disease caused by bacteria. It usually attacks the lungs but can affect other parts of your body as well. TB is hard to tackle mainly because it spreads through the air. When a person with active TB disease in his or her lungs coughs or sneezes, the bacteria are released and can stay airborne for several hours. Those who breathe in the bacteria may then become infected. Thus, TB usually spreads to people who live or work closely together with an untreated, infectious patient with active TB disease. Most people infected with the bacteria remain well, but have latent TB infection. This is a condition where the TB bacteria are kept under control by the person's immune system. People with latent TB infection do not feel sick and do not spread the germs to others. But when the bacteria cannot be kept under control by the immune system, the infection progresses to active TB disease.
Latent or active TB. In most healthy people, the immune system is able to destroy the bacteria that cause TB, but in some cases the bacteria infect the body but do not cause any symptoms, or the infection begins to cause symptoms within weeks, months, or even years. Up to 10% of people with latent TB eventually develop active TB years after their initial infection. This usually happens either within the first year or two of infection or when the immune system is weakened. For example, if someone is having chemotherapy treatment for cancer.
Tuberculosis, or TB, is one of the oldest and most common infectious diseases. About one-third of the world population is believed to be infected with TB. Fortunately, only about 5% of these infections progress to active disease. The other 95% of infected people are said to have a dormant or latent infection. They do not develop any symptoms and do not transmit the disease. Tuberculosis is caused by a rod-shaped bacterium, or a bacillus, called Mycobacterium tuberculosis. An infection is initiated following inhalation of mycobacteria present in aerosol droplets, discharged into the atmosphere by a person with an active infection. The transmission process is very efficient, as these droplets can persist in the atmosphere for several hours and the infectious dose is very low. Less than 10 bacilli are needed to start the infection. Once in the lung, the bacteria meet with the body's first-line defense, the macrophages. The bacteria are ingested by the macrophages, but manage to survive inside. Internalization of the bacilli triggers an inflammatory response that brings other defensive cells to the area. Together, these cells form a mass of tissue, called a granuloma, characteristic of the disease. In its early stage, the granuloma has a core of infected macrophages enclosed by other cells of the immune system. As cellular immunity develops, macrophages loaded with bacteria are killed, resulting in the formation of the caseous center of the granuloma. The bacteria
Method. Persons 50 years of age or older who resided in 6 intervention clusters were screened for pulmonary tuberculosis regardless of symptoms annually for 3 years beginning in 2014 by means of rapid nucleic acid amplification. In 2014, by means testing of spontaneously expunged sputum samples. Active screening was not performed in the 60 control clusters in the first 3 years, The primary outcome measure in the fourth year was the prevalence of microbiologically confirmed pulmonary tuberculosis among persons 15 years of age or older. The secondary outcome was the prevalence of tuberculosis infection as assessed by an interferon gamma release assay in the fourth year, among children born in 2012.
Five things to know about tuberculosis, or TB. 1. Anyone can get TB. TB bacteria are spread through the air when a person with TB disease coughs, speaks, or sings. 2. TB is not a disease of the past. CDC estimates up to 13 million people in the United States have latent TB infection. People with latent TB infection do not have symptoms and cannot spread TB bacteria to others. However, without treatment, 5 to 10% of people with latent TB infection will develop TB disease at some point in their lives. For some people, the risk is much higher. 3. TB can happen anywhere. TB cases are found in all 50 states. 4. Treating latent TB infection is effective and can prevent the development of TB disease. 5. It's important. If you are at high risk for TB infection, you should get tested and treated if you have it. Together, we can end TB in the United States. Learn more about tuberculosis by
Results. In the fourth year prevalence survey, we tested 42,150 participants in the intervention group and 41,680 participants in the control group. A total of 53 participants in the intervention group and 94 participants in the control group had pulmonary tuberculosis, as confirmed by a positive nucleic acid amplification test for Mycobacterium tuberculosis. The prevalence of tuberculosis infection in children born in 2012 was 3.3% in the intervention group and 2.6% in the control group.
Well, I started having symptoms in September of last year. I was diagnosed for pneumonia, and so I ended up going to the hospital for something different. And when I got to the hospital is when they had ran a chest x-ray.
In conclusion, 3 years of community-wide screening in persons 15 years of age or older who resided in Cao Mau Province, Vietnam resulted in a lower prevalence of pulmonary tuberculosis in the fourth year than standard passive case detection alone.
updated tuberculosis screening, testing, and treatment recommendations for healthcare personnel. On May 17, 2019, the Centers for Disease Control and Prevention and the National Tuberculosis Controllers Association updated recommendations for tuberculosis or TB screening, testing, and treatment for healthcare personnel in the United States.
These recommendations should be used for people who work or volunteer in healthcare settings, including inpatient and outpatient settings, laboratories, emergency medical services, medical settings in correctional facilities, home-based healthcare and outreach settings, long-term care facilities, and clinics in homeless shelters. CDC and the National TB Controllers Association recommend new hires receive a baseline individual TB risk assessment, symptom screening, and a TB test.
In the United States, there's no recommended annual testing for TB unless there is a known exposure or ongoing transmission at a healthcare facility. Healthcare personnel with a positive TB test result should receive a symptom evaluation and chest x-ray to rule out TB disease.
Treatment for latent TB infection is strongly encouraged. Shorter treatment regimens should be used as they are more convenient and more likely to be completed. Healthcare personnel with untreated latent TB infection should be screened annually for symptoms of TB disease.
Symptoms for TB disease include any of the following: a cough lasting longer than 3 weeks, unexplained weight loss, night sweats or a fever, and loss of appetite.
All healthcare personnel should receive TB education annually. TB education should include information on TB risk factors, the signs and symptoms of TB disease, and TB infection control policies and procedures.
State and local TB screening and testing regulations may differ based on local needs. The CDC and the National TB Controllers Association TB screening and testing recommendations do not override or replace state regulations. Contact your state TB control program for more information.
CDC has resources to assist facilities with TB screening for healthcare personnel. Visit www.cdc.gov/TB to learn more.